We're at a critical moment as we witness the greatest positive transformation of healthcare in our lifetime. However, disparities in healthcare not only remain, but are increasing. Northwell Health and Aegis Ventures have partnered to launch Ascertain, a bold collaboration to drive AI-backed companies that save lives and resolve long-standing health inequities. Our partnership brings together healthcare, academia, life sciences, data science, and venture capital, all under the same roof. And together, we are building AI-enabled solutions that deliver better outcomes for everyone.
We like to partner. We love to deal with other groups who bring to the table things that we may not have, because when you work with somebody else, we learn from each other, share information, we educate each other, and if we do it correctly, we will improve the product so that we can better serve the public that we're all in the business to serve. That's why the relationship with Aegis is so important.
There can be no greater demonstration of our vision than healthcare AI. To date, with a few rare exceptions for which we should all be grateful, the vast majority of AI in healthcare has either failed or succeeded for some, but not all. When combined, the resources of Northwell and Aegis are unique and extraordinarily powerful. Together, with the launch of Ascertain, we have the ability to create AI in healthcare that not only generates substantial improvements in care at a reduced cost, but is also equitable for all.
For those of us who work in healthcare, we can be extraordinarily proud, because that has been extraordinary progress. We have done a great deal. Given all of the scientific discoveries, all of the advances in care delivery, so much has improved over the years. So we should feel very good about this, and it's important to feel good about what has been accomplished. There are, however, as we all know, extraordinary gaps. There is so much more to do.
Health equity is an issue that has been at the center of my life's work. Social determinants of health, including income, education, community safety, and food availability, limit access to healthcare for people of color. We saw this front and center during COVID-19 as it was revealed that the age-adjusted COVID-19 fatality rate of New York's BIPOC population was twice as high as that of white New Yorkers. These disparities are shocking and need to be addressed. The ethical use of technology has the power to break down barriers and address racial disparities in healthcare. The opportunity is immense, but there's still so much more to be done.
One clinical condition that underscores the disparities affecting people of color is preeclampsia, a pregnancy complication characterized by high blood pressure that threatens both mother and fetus. Preeclampsia affects Black women at 3 times the rate of white women, and with greater severity. Aegis's data science team has been working with Northwell's clinicians to examine thousands of cases to better forecast expectant mothers who could benefit from additional specialized care and early intervention.
As a nurse practitioner, I frequently see disparities that exist for my patients in pregnancy care and so many other conditions. But you know what is truly exciting? Is the potential for AI to identify women early, women who are at high risk, so we clinicians can make sure that they receive the targeted care that they need.
While we're still in the early stages of our journey in bringing AI and ML to healthcare, it'll be collaborations between patients, providers, technologists, and industry innovators that will drive adoption and bring these solutions to patients and their families. Access to massive data sets and identifying the most urgent healthcare problems are key to solving some of the biggest challenges we face in medicine.
Northwell has always had a history of reaching out and being creative and entrepreneurial.
Ascertain is a new way forward, a monumental step toward real, proven AI solutions that bring impact to the world. We are driven by a single purpose: to realize results that deliver something greater in healthcare. Ascertain something greater.